Hello, everyone. My name is Efa Kenny Moronta Polanco, and I'm a family nurse practitioner student from Franklin University. Today, we're going to talk a little bit about caring for the mental health needs of the elderly. I hope you like it. Epidemiology of the elderly. According to Linford and Hughes, the United States defined the elderly as people between 65 years and above. Aging comes with many complexities, as some of these have been reported to cause mental illness among the elderly, hence making mental illness among the elderly a matter of importance. Some of the multifactorial aging changes that make elderly health issues important includes diabetes, depression, and hearing loss. For instance, the long-term stress of dealing with diabetes can lead to mental illness among the elderly because of the change in blood sugar, which affects their mood and cause other mental symptoms such as anxiety and trouble thinking. Linford and Hughes, 2020, asserts that diabetes causes a situation known as diabetes stress, which shares the same traits as mental illness, such as anxiety, stress, and depression. Therefore, these situations show why mental illness should be taken seriously among the elderly. Some common mental illnesses among the elderly are anxiety disorder, psychosis, and dementia. These mental illnesses among the elderly lead to severe issues such as behavioral disorders, sleep disorders, and confusion. Therefore, it is essential treatment mental illness disease among the elderly to help improve the quality of life among the elderly as well as decrease the mortality rate among the elderly. According to Seti and Sari, 2011, treating older people with mental illness require well-coordinated psychological therapy with well-trained psychiatrists and other medical treatments forms to help intervene. The most proper and standardized assessment and screening tool for mental illness among the elderly is the Mini-Mental State Examination, also called MMSE, a cognitive assessment. Usually, the cognitive assessment is an essential tool to screening mental disease among the elderly and is also used to assess the progression of the patient with dementia. Notably, the mini-mental state examination is an essential tool for treating conditions such as depression and dementia among the elderly. Moreover, geriatric depression scale is also a necessary tool in assessing and treating mental illness among the elderly. The scale was developed purposely to screen depression among the elderly. The tool has been effective since it can identify the behavioral symptoms of depression. For instance, on a scale of 0 to 15, the tool can measure the rate of depression, while 0 to 4 is considered as usual and 12 to 15 is considered as severe. The use of 4Ds of the psychological assessment tool is also important in treating mental illness, and they include cognitive decline, delirium, dementia, and depression. Treatment plan for mental illness among the elderly. Or 2015 asserts that usually mental illness among the elderly goes untreated since most people assume that mental illness among the elderly is something normal and common among them. Board also provides various treatment plans for mental illness among the elderly. For example, using psychotherapy to explore thoughts and feelings in this population. Considerably supportive Psychotherapists help the elderly to deal with mental illness by building self-esteem among them and improving their social and community performance, which in turn positively affects in their life. On the other hand, counseling allows the elderly to share their problems in a safe environment since counselors help the elderly to deal with negative thoughts and feelings. Creating support groups is another treatment plan for this population with mental illness. These support groups allow the elderly to feel less lonely, reduce stress since they can engage with peers and improve skills to cope with challenges and other things. Moreover, the residential treatment allows the elderly with mental illness to develop healthy habits and engage in supportive structures and routines. Assessment of the treatment plan for mental illness on the elderly. According to Board 2015, treating mental illness among the elderly is essential and should not be ignored. Treatment of mental illness helps to reduce the psychiatric disorders among this population. Mental illness is a common and complex among in this population, and it occurs with aging, hence failure to comply with a treatment plan and worsen the condition. Some of the importance of the treatment plans among the elderly includes support groups allow the elderly to vocalize their feelings and then experiences less loneliness, isolation, and judgment, which is an essential step on their recovery. Moreover, support groups allow retention and engagement in the mental health care system. For instance, the patient experiences the feelings of the togetherness and the comfort that comes with the understanding that they are not allowed to do this type of journey. Another treatment, such as counseling, helps the elderly to find a new source of enjoyment. When people with mental illness engage with people who empathize with them, they feel secure and ready to take their advice. Moreover, retention programs help the elderly to develop an overall feeling of well-being. These programs improve an individual's psychiatry symptoms and quality of life. Let's also talk about the side effects of a treatment plan. Despite the numerous benefits that comes with the use of treatment plan to treat mental illness and elderly population, these treatment plans also come with various side effects. For instance, using medical forms to treat mental illness among the elderly may lead to other complications such as dizziness, muscle cramps, and headaches. The use of medications such as depressants, stimulants, and antidepressants to treat mental illness among this population comes with several complexities. The side effects can be hazardous when the patient have to take the drug alone. In addition, the treatment of mental illness among the elderly can lead to psychiatric stigma. The elderly with mental illness can experience a stigma, especially when exposed to psychiatrists and support groups that negatively view them because of their mental illness. Moreover, undermining the treatment plan may also affect their health. Most people believe that mental illness is a common and normal situation among this kind of population. Therefore, they see no need to treat it. Consequently, they fail to take the medication as prescribed, negatively affecting their health, and in addition, social exclusion used to treat mental illness also affect the elderly since it contributes to issues such as depression and low level of self-esteem. Let's also talk about collaborative interventions and psychotherapeutic options for treating mental illness in the elderly population. When treating mental illness among the elderly, collaborative interventions and psychotherapeutic options are inevitably. According to Craven and Bland, there are various collaborative interventions and psychotherapeutic options for treating mental illness among the elderly, including programs such as prevention and elderly interventions in the elderly. The PEI is a program that it means to provide short-term mental health treatment to the elderly to prevent mental illness conditions from getting worse. Prevention and early intervention for the elderly are designated to enhance the quality of life. Craven and Bland 2006 also asserts that multi-components intervention is another collaborative method of treatment of mental illness in the elderly population. Notably, in multi-component interventions, patients get nutritional counseling and technical supports, such as engaging in physical activities such as aerobics and flexibility exercises. Mental health crisis intervention is another collaborative way of treating mental illness among the elderly. Since persons experiencing mental health issues might be a danger to themselves and those around them, mental health crisis intervention is important. Mental health interventions crisis is vital since the intervention plays a significant role in addressing emergencies and also providing resources to individuals who are in need. In conclusion, treating mental illness among the elderly is essential. Even though some consider mental health issues among the elderly as usual, it is vital to treat them since good mental health contributes to the overall well-being of the patient and the family members. Moreover, untreated mental health illness among the elderly can lead to poor quality of life and an increased mortality rate among the elderly. Common mental illness among the elderly, as it was expressed before, are depression, dementia, and psychosis. The most contributory factor to this mental illness are the age and other diseases such as diabetes, hypertension, chronic kidney disease, chronic heart failure, and others. Therefore, it is crucial to assess the screen mental illness among the elderly and employ treatment plans such as support groups, counseling, and psychotherapy to treat the mental illness. Despite the side effects that comes with these treatment plans, the positive outcomes of treatment of the mental illness outweighs the negative in the treatment plans are taken positively and effectively. Are all my references, and thank you so much. I hope you like my presentation.